Hi, I'm Dr. Mary James, optometrist and assistant professor for the Department of Ophthalmology at University of Arkansas for Medical Sciences. Today I'm going to discuss some points for taking care of the visually impaired. First, we'll go over some of the common eye conditions. Cataracts are when the eye's natural clear lens becomes cloudy. This is due to a protein breakdown and is most commonly seen with age. Some symptoms from cataracts include blurry vision, decreased night vision, and faded colors. This is a great picture that shows what the patient with cataracts may see. So on the right, you can see there's still some detail in the image, but overall, the image is more blurry compared to the left side. Cataracts usually develop very gradually. They are treatable with surgery. This is more so in the United States. There are some countries where patients don't have access to care, so cataracts can cause blindness if not treated. The second condition we'll go over is macular degeneration. This is a disorder that affects the macula, which is the central tissue in the back of the eye. Macular degeneration is due to a breakdown of the outer layers of the retina. You can have problems with central vision, most commonly with fine detail and color discrimination. Macular degeneration is most commonly bilateral, but it can be asymmetric. Usually in the early stages, patients may notice distorted central vision, so lines on paper may seem broken up or wavy. If the patient looks at a telephone pole, there may be kind of a notch in it or a waviness in the center. In the late stage, patients have significant central vision loss, so instead of just this wavy line, they're actually going to have missing vision. Macular degeneration is one of the most common causes of irreversible vision loss in developed countries. The dry form is the most common form. It accounts for about 80% of macular degeneration patients. There is no treatment for this form, but close monitoring is indicated because if there is conversion to the wet form, we want to catch that as soon as possible. You can see in the top right image there are yellow clumps right in the center of the macula. Those are particles called drusen. Drusen develop as protein clumps up in the macula, and those clumps of drusen can coalesce together and later on form scarring or leakage of fluid or blood in those areas. Wet macular degeneration is less common but more serious. You can see in the photo on the right the area of red, and that's a hemorrhage in the macula. So these patients are going to have very severe vision loss. A lot of times it's sudden onset. When you have these new abnormal blood vessels that grow and leak blood, that's when there's an indication for treatment. This image shows what a patient with macular degeneration may see. One of the most common complaints I get from macular degeneration patients is that they're having trouble recognizing faces. And you can see in the image here why that is. A lot of my patients say I'm out to eat at a restaurant and somebody is approaching me and I can't tell who it is till I either hear their voice or they get really close. And so we do have some devices that can help with that. Macular degeneration is more common in patients that have a family history, those that smoke cigarettes, Caucasians, females, patients over 50 years old, those that are overweight, have high blood pressure, or have an unhealthy diet. Glaucoma is when the eye pressure damages the optic nerve, which is the structure that connects the eye to the brain. If a patient has damage to this nerve, it can cause peripheral vision loss. And if glaucoma goes untreated, it can cause progressive peripheral vision loss. 50% of people that have glaucoma don't actually know they have it, and that's the scary point with this disease. Glaucoma is treatable. Treatments may include eye drops, laser procedures, and/or surgery. The important point with glaucoma is once you lose peripheral vision, you can't get it back. And so it's very important that this disease is diagnosed early and treated as soon as it starts. People at a high risk for glaucoma include those with a family history, African Americans, Hispanics, and Asians, chronic steroid use, history of eye injury, and once again, high blood pressure and diabetes. Another scary point with glaucoma is you can lose 40% of your peripheral vision and not know it. And so by the time these patients come in with vision loss, they've already lost a significant amount of their peripheral vision, and that's something we can't get back with treatment. If you look at the image here, you can see on the right what a patient with glaucoma may see. This is another important discussion we have with severe glaucoma patients, is that it's probably not a good idea to be driving. And so we do specific tests to see the amount of peripheral vision that they have and make sure they meet the Arkansas driving requirements. If you've lost a significant amount of peripheral vision, you may miss a stop sign, you may miss a child or an object running out into the street. And so it's very, very important that this discussion is made with glaucoma patients. And the last disease we will discuss is diabetic retinopathy. In 2018, 13% of the adult population in the United States were diagnosed with diabetes. Diabetic retinopathy affects 1/3 of patients over the age of 40, and this is the leading cause of blindness in working age adults. The number of patients with retinopathy is expected to double from 2010 to 2050. Unlike the previous diseases we've talked about, diabetic retinopathy can actually cause central vision loss and peripheral vision loss. Central vision loss is caused from diabetic macular edema. This is when we have leaking of fluid in the macula, which is this central tissue in the back of the eye. If a patient has diabetic macular edema, it can cause blurry vision, distorted vision, or missing central vision. If you look at the scans on the right, the top scan is of a normal macula, so you see all of the lines are straight. And if you look down on the bottom image, you see those black pockets within the macula, and those are areas of fluid leakage. So that patient is having to look through those pockets of fluid when they're looking at anything with their central vision. Peripheral vision loss from diabetic retinopathy can be caused from attractional retinal detachment or dense panretinal photocoagulation, which is a type of laser that actually treats severe diabetic retinopathy. And the theory of this laser is that if we laser the peripheral tissue, it actually preserves the central tissue. So these patients do have peripheral vision loss from the laser, however, we're preserving their central vision. Now that we've discussed some common eye conditions, let's talk about preventing vision loss. The most important point for preventing vision loss is an annual eye exam. All patients must have an annual eye exam and have their eyes dilated, even if they don't have any symptoms. An annual eye exam can save a patient from the consequences of visual impairment, and some patients don't know how to express their vision complaints, especially if the visual decline is gradual. Another point to think about is we all have two eyes, and so if one eye has visual decline and the other doesn't, some patients don't notice that. So we want to catch any type of visual decline or visual disease as soon as possible, and that's done through an annual eye exam. If we look at visual health recommendations, protective eyewear is really important. A lot of patients think of this when they go to a job where it's required or recommended, but they don't often think of this when they're doing yard work, doing home improvement projects, or playing sports where a ball can come towards the face. Sunglasses are also very important. Sunglasses that are worn need to block 100% of UVA and UVB light. Resting your eyes from screens and near task. Research has shown that the 20-20-20 rule is important for resting our eyes from screens. The 20-20-20 rule states that for every 20 minutes that you're on a screen, you should look 20 feet away for about 20 seconds. That's going to give our focusing system some time to relax. Healthy diet is also important. Lots of fruits and vegetables and fish high in omega-3 are important for the eyes. Blood sugar control, blood pressure control, and knowing your family history can also be important for vision health. Lastly, we'll talk about low vision. Low vision is a vision deficit that impedes performance of everyday tasks. So this is when your patient can no longer benefit from glasses, contacts, or surgery and needs different devices to help maximize the vision that they do have left. Low vision is commonly seen in the elderly population due to increased risk of macular degeneration and glaucoma. The scary point with low vision is that the number of individuals with age-related vision problems is anticipated to double by the year 2050. The aging population is more likely to be deprived of adequate lighting, and this is due to lack of time outdoors, poorly lit indoor settings, and eye conditions that cause reduced transmittance of light. Along with low vision, poor lighting can cause disorientation and risk of falls. Poor light exposure can also influence the circadian rhythm. And if this is altered, patients can have issues with cognitive, mood, and behavioral disturbances. Sensory impairment is also something that we see with low vision. So if a patient has visual impairment, it could lead to depression, social isolation, and reduced physical activity. Annual eye exams, again, are very, very important to prevent vision issues as well as these types of mental health problems. So in our low vision clinic, we have devices that can help at both near and distance. Near devices may include prism readers, which range from a +4 to a +12. These are reading glasses that are stronger than what you can purchase over the counter. We have handheld magnifiers. These are devices that can enlarge reading material. And then electronic magnification. These are electronic magnifiers that can magnify text or objects stronger than what you see with just your typical handheld magnifier. One of the great things nowadays is iPhones and iPads have wonderful accessibility features and even a magnifier included. If you look at the image on the top right, this shows why it's important to magnify text for patients with visual decline. If you have a missing area in your central vision from macular degeneration or diabetic macular edema, enlarging the text or magnifying the text around that area of missing vision will allow the patient to better depict the specific letters and then read the overall word. When we look at distance devices, we have monocular telescopes, spec-mounted telescopes, also known as bioptic, which you can be certified to drive with in the state of Arkansas if you meet the requirements. Max TV glasses are glasses that you can wear to maximize and magnify the TV screen, and then electronic magnification. Some examples of these are the Orcam and the eSight, and you can see those in the two pictures on the right. We have non-optical devices, and there's a long list of these. Some include the talking watch and talking clocks, large print checks, writing guides, liquid level indicators, voice-activated computers and speech recognition software, large TV remotes, keyboard stickers that increase contrast or enlarge the font on the keys, and audiobooks. A few things as a healthcare provider to keep in mind are that it's important to familiarize yourself with the most common eye conditions. When you're familiar with these, you can really tell where a patient may be having deficits if they have one of these conditions. It's important to emphasize the importance of eye health in an annual eye exam, and also know your resources for patients who are visually impaired. Some of those include our low vision clinic at UAMS, World Services for the Blind, and Department of Services for the Blind. So one more takeaway, please, please, please refer all your patients for an annual eye exam. Make sure they've had a dilated exam in the past year, because if we can catch conditions early and treat them as soon as possible, we may be able to prevent permanent vision loss. I hope you found this information helpful today. I have included my email. If you have any questions, I'm happy to answer those. We are always accepting new patients at the Jones Eye Institute at UAMS, so if you or any of your patients have any visual concerns, we are happy to help.